the faculty who are here, the staff who are here, and of course the students of the class of 2023 who are joining us for this white coat ceremony here. It's kind of interesting. I've never done a white coat ceremony, 3 months before graduation. Well, we did mention that you have to wear the white coat for a minimum of 2 years, so we presume that all of you will be spending the mandatory 2 years after we put the white coat on you before graduating. No, not such a good idea. For family, there are some family here. My name is Mark Wolf. I am the Morton Amsterdam Dean of the School of Dental Medicine. I do look forward to just talking for a very short few moments about the white coat and the reason for white coat ceremonies altogether. This is very interesting as we do this. We're gathered here. Do you remember what you were doing 2 years ago at this moment, at this time? 2 years ago, 2021, the beginning of February, your class was not totally online, but we were starting to get you vaccinated so that you could enter the clinic, and we were trying to move forward in what would be a changed environment where we were able to treat patients and have some sense of safety that this would not be something that caused, you get used to kids, you don't hear them, and how many of you are heading to peds? Welcome to the new world. It's so interesting how this evolved and where we were, because we had a sense of desperation. We had a sense that things were in terrible shape in 2020, and when we emerged into 2021, it became a race for, here's my arm, I'm ready for the shot. And that was a great invention and great item to see come about in literally less than a year after the disease broke out. Science prevailed. Science prevailed in every way. It was called an unprecedented pandemic. I do have to tell you that the flu of 1918 ravaged America when our population was 1/3 the population and took about 700,000 lives, with large area right here in Philadelphia being an epicenter. They ran right at the peak of the flu season. They ran a bond parade in town to try and raise money to support World War I and spread this disease throughout. Penn Dental Medicine did close then also for 1 week. The students actually went out to help move bodies and help bury individuals who unfortunately perished under that flu pandemic. We're fortunate that we did not have to go to work and try to reduce the pandemic as part of what we did. We just tried to keep people out of the hospitals and deliver dental care and take care of them in every way. The interesting thing is that this pandemic has actually not relented in any way. The 7-day mortality rate, when we were talking in January of 2021, less than 160,000 people had died of COVID at that particular point. Today, well over 1 million. We had 5 million people had gotten COVID in that first year of the disease. Today, over 170 million have gotten COVID. The death rate in the United States of COVID is the 7-day average is 518 people die every day right now, and we've become kind of numb to it. We go out to restaurants, we go out and socialize, and we just kind of get used to that item. I'm not sure that that's a great thing, quite frankly. And we've seen a breakdown in how people relate to each other and how we respect each other's abilities and resistances. I'm in my 60s. I'm considered in that high-risk group. I do have high blood pressure, treated by medications, doing okay, except when fourth-year students bother me and give the dean a hard time, then it probably rises slightly. No, not really. It's actually interesting. There's been a breakdown of this societal norms that we want to protect each other. To the point when I walked into an airport and things were crowded a few days ago, I was visiting a school in South Africa. I put on a mask because there were crowds as we were moving through security. And there were actually comments about, oh, he's afraid of getting COVID. The answer is yes, I actually still am. It doesn't prevent me from treating patients, from working with students, but there are times when we need to, what's happened that when somebody wants to protect themselves, it becomes something that another individual can ridicule. What happens, I bet you all of you have had your polio vaccine. There's a group of people in the United States right now that have become so anti-science, anti-vaccination, that they've stopped taking polio vaccines, initially for religious reasons. It required an administrative change that said, if you don't take polio vaccine, you cannot attend school. A breakdown in science. How many billions of polio vaccines have been administered? Polio disappeared in the United States and virtually throughout the world. So many of you have come from other nations where there were some low incidence of polio. But at this particular time, polio had almost totally disappeared. New York had a case of polio. How about measles, mumps, and rubella? Such science breakdown, such belief in science breakdown, that people just stopped. No, I don't want to take that vaccine. It might be dangerous. Or I heard that it's hazardous. I heard that you could develop this. Well, with all vaccines and everything that you've learned in the 4 years, in the time that you became a dentist, in the 2.5 years you're here, you recognize that science changes. The things we know are not necessarily things that are forever. We have a scientific mind. We read, we understand. What was the breakdown that took place? It was a breakdown in trust of honored science things. A man who helped bring us out of an epidemic of HIV suddenly becomes vilified in an attempt to prevent everybody from getting COVID. Oh, Dr. Fauci said, don't use masks. You can use cloth masks, but don't put a medical mask on. Does anybody know why he said don't put a medical mask on? There weren't enough of them. There were shortages. There were medical doctors, nurses, and staff in hospitals treating active COVID patients wearing a pull-up mask, cloth mask over their face because they couldn't get surgical masks. Then all of a sudden they say everybody should wear a mask, and the literature, the stuff that shows up online is going, oh, wait a minute. They said don't wear masks. Now they're saying wear masks. And there's a whole group of individuals that change the discussion. If we go ahead and look at fluoride on Google, there's a good chance that you will see that it's a poison and harmful more frequently than you will see that it is probably one of the greatest public health breakthroughs in history. Reducing decay rates, reducing dental infections massively over the last 50 years. And yet today, information has become so easily findable, but good information does not. We know that Google, we know that Facebook, we know that Twitter, we know they watch where you're going, who you're talking to, and what's going on. And you get a feed of information when you just ask a question that fits your particular thought process. So it means that, news comes at us, and when you Google vaccine, if you have any doubts about it, if you've been looking at those locations, you get solid evidence that vaccine is horrendous. You get case report after case report after case report. And what's the uneducated, non-scientific mind supposed to do about this? They have to find trusted individuals that can interpret the science and go, no, wait a minute. All vaccines are not bad. There's a risk of a vaccine, and the fact that you had pain or that you passed out or that you did not feel well the next day, that is not necessarily an adverse event that requires you to not take the vaccine. And it doesn't mean that the vaccine, this vaccine didn't work. When you took the vaccine, when I took the vaccine, we all thought we couldn't get the disease, and even more importantly, we couldn't transmit the disease. Oh, that was a lie. And you'll see today in the news, you will see people as they do the investigation with Dr. Fauci, questioning him on that very fact. Why did you deceive the nation and say that this would prevent the spread of the disease? Oh, well, this vaccine was a failure. People who get the vaccine are 95% less likely to go into the hospital and 99% less likely to die. By what measure is that not a successful vaccine? It's an incredible time where science has suddenly come into doubt. And there are people that say there are multiple truths, and there are two ways that we can look at these facts. What does the white coat ceremony have to do with any of this? When we put on the white coat, we are expected to become part of a group of individuals that are trusted by the public to always put the truth, to always put the betterment of society ahead of ourselves. Even if it's not profitable, even if it hurts. But we're expected to be the trusted individuals. You work in communities, you live in communities, you will be one of the smartest people on the block. And for some reason you put that white coat on and people instantaneously think you're smarter. You've made it through dental school now almost twice. We know you're smarter. You live in rarefied air of intellectual learning and capability. You have the ability to make a difference in people that trust you right now. They came to you, they sat, they let you do things that are uncomfortable, things that may hurt, things that create fear in them, and yet they trusted you with this. Do you realize the power at your hand to talk truth to rumor? To think about the public betterment as you have the ability to sit with these individuals. They're already trusting you. By the way, It's a captive audience. And you can have that conversation about, I know you didn't think about the vaccine, or your child hasn't been, we can treat things and can control things. Do we need to see an oropharyngeal cancer ever again in our life? We can have a conversation that says, if you get this HPV vaccine, we can reduce 80% of oropharyngeal cancers, as well as cervical cancers. How are you going to put on the white coat and become the trusted authority to help patients in making the right decision? So this white coat ceremony didn't exist in 1970s. It wasn't until the late 1980s that at Columbia University, they thought that medical students should essentially take an oath that commits them to the things we will talk about in the next few moments. Honesty, being consumers, smart consumers of science, being a voice that helps society make the right decisions going forward. That's what the white coat is about. Being the trusted individual when somebody passes out in the restaurant on an airplane and they ask for help, that you stand up selflessly, let your dinner get cold, and help that individual. Because you have the training that's probably better than 98%, 99% of the people that are there. Or you could continue eating. You could ignore the events. But that's not what the white coat means. It means that you're going to stand up and do what's necessary whenever, wherever, and whenever. This is a... So I have to tell you, when I arrived here, I originally did not want to do white coat ceremonies in the first year. I wanted to do them in the late second year when students finally started understanding what it was to be a healthcare professional, to be a doctor. I was wrong, and today I know really well that this ceremony, the same as a marriage, a vow that is taken with an exchange, this ceremony is a statement by which you commit to being part of this profession 24/7, 7 days a week. Doing the right thing. It's more than infection control. It's caring. It's more than a billing for a procedure. It's explaining to somebody who just doesn't understand in language that they can understand, so that they can become an informed consumer. It's when you're in a rush and the patient is uncomfortable, slowing down and asking the patient, is there something I can do to help you? You seem uncomfortable. When a patient says, I can't eat well with my dentures, you have to ask the question, is it, can you not eat well because you're not getting good food, or your dentures don't fit well? And if the dentures don't fit well, that's what you received massive training in. But as a human, we all have a massive training in what we're supposed to do if the person's not getting food. 1 in 5 children go to sleep hungry with food insecurity. How can we help them get food? Is it Meals on Wheels? Is it a call to a social worker? Is it talking to an individual? How do we identify those people that are in need? That's what the white coat is about. It's figuring out how to help each other. It's figuring out how to tell the truth all the time, even when it's a difficult truth. But it's critical that you have to participate in it. It's a participatory step. It's important to you to understand that the oath you're going to take has awesome expectations and awesome requirements for you. You've come this far. You've done dental school once, you've done dental school a second time now, and you're just about at the finish line. It's not an end point. You're going to do more education, more time in school, more questions of you. You'll have more challenges. You will never have the opportunity to make an unethical decision. Remember, nobody can give away your good moral standing except you. That's a terrible weight on your shoulders. It means when you're trying to figure out, I just need to make a payment on this car, or, this patient doesn't need that restoration. What are you going to decide? I hope it's very clear to you. But the white coat ceremony you're participating in here actually is that binding, that obligation that we ask you to take part in. I ask you to think in real terms about who you are and where you are. You're joining a very special club. Penn Dental Medicine graduates are the most respected in the world, throughout the world. In another, how many days are left? I'm sure somebody has counted down. 98 days. There are certain prompts you don't have to worry. Somebody's got that answer. They have no idea when the white coat came into usage, but the 98 days, does that include weekends? Yes. Oh, so that's a raw number of 98. In 98 days, you're not done. You're just starting your journey. It will be forever a challenge, I hope. It will be forever something good that you enjoy doing. If after all the time you've done this, you don't go to work with a smile on your face, enjoying what you're doing, get out of the profession. You're still too young to go the rest of your life like that. Your smile is something that will be contagious for everybody. Your smile will be something that will help people grow. Your smile can be transferred. You actually have the skills to make a smile. It's an incredible and awesome obligation that's upon you. I'm asking you to go out and enjoy yourself. Be part of an alum that is just renowned throughout the world for what we have accomplished. Remember, a Penn alum discovered why we get tooth decay. A Penn alum started the discipline of oral medicine. A Penn alum advanced periodontal treatment in every way. Penn alums have essentially papered dentistry in so many different ways. You become one of them now. You're never done. You're never not a Penn alum after this. You're always part of our family. So this will be a big step coming through, and I'm asking you to take the giant leap of being the very best Penn alum that can be graduated and representing what the white coat oath actually means in every way. So family and friends, thank you for getting them through school once and helping get them through school a second time. Each of you in the class of 2023, thank you for coming to Penn and making this decision, because I do believe that you have gotten the value in education and the growth and the capability to be a leader amongst leaders. This is a big deal, and in a few moments we will put the white coat on for you. Actually, yes, somebody puts it on for you, and we will take a couple of pictures, and then we will say the white coat, the oath for dentistry from Penn Dental Medicine. Right now, I would like to welcome, so thank you on that. Right now, I would like to welcome today's speaker, Tamara Greenfield King. Ms. King serves and is an interim provost for University Life and a senior associate vice provost for student affairs. She came to Penn in 2019 after 20 years in positions of increasing responsibility at Washington University, St. Louis, culminating in an Associate Vice Chancellor for Student Support and Wellness. She's a sought-after expert in student conduct and Title IX, serving as the first African-American president of the Association for Student Conduct Administration. Prior to higher education, Ms. King was the first African-American assistant district attorney in Northampton County, Pennsylvania. She earned a law degree from New York University, a baccalaureate degree in political science from Penn State University, and we're delighted to have Tamara here to welcome you to this white coat ceremony on the beginning of your end of your journey here at Penn Dental Medicine. Thank you. Thank you, Tamara. Huh? You know, you're so true to this.
Thank you.
You got it.
Good evening. Oh, much better than that. Good evening. Thank you. I heard one little kid. Thank you for yelling. Again, Tamara Greenfield King, currently serving as the interim vice provost in university life here at the university. We are responsible for activities for our students that happen outside of the classroom for the most part. And we work with our undergraduate student population and our graduate and professional student population. And there's about 15,000 graduate and professional students here at the university. So first I want to say an early congratulations. I recognize that you all have 98 days, including the weekends, to get through this encounter. So I think it's not too early to say early congratulations for a long journey in getting here at Penn Dental. I want to also just leave you with a few words. I'm not going to be long. You all have a lot of children. I hear some people, some of the kids and some have gone outside. So I understand that sometimes that can be a little distraction, but you know, it's all good. They're part of your journey as well. While you've been in the program, everyone has sacrificed, family members and the like, so that's okay. But I won't be before you long. I just want to take some time and number one, thank the Penn Dental staff, faculty, and the deans. They've worked incredibly hard to prepare you for your next chapter in your life, which is potentially practicing dentistry here in the U.S. So no matter where you've come from across the globe, we welcome you and we look forward to seeing what you'll do. When Dean Wolf talked about the brightest and smartest people in the world at Penn Dental, he meant that. And with that, you all have been given an awesome responsibility. And Dean Wolf talked a little bit about that, but I'm going to be really pretty transparent with you all. There are people in this world who have never been to the dentist because they cannot simply afford it. You have a gift, you have a talent, and you have the resources. And every once in a while, you need to remember that to whom much is given, much is required in return. So given the training that you all have, I need you to think about that young child, that elderly person who's having issues, someone who's lost their job, and think about, can I do this one? Because it's the right thing to do, whether someone can pay or not pay. In the legal world, that's called all of our pro bono work that we do for people for free. Now, I haven't practiced law in 25 years. People still call me for legal advice. I'm like, you recognize that I don't know current law. You might not want to ask me for advice, but I can talk to them about basic concepts and then send them to an attorney who is still practicing. But I was chatting with the deans today, and this is where we were talking about dentistry in the kitchen of our office, because one of our workers, her son, on Friday, it was raining outside. They let them go outside and play in the rain at school. He comes back in, he slips and falls face first. He's 8. His 2 front teeth aren't knocked out, just broken across. And it's like a little bitty nub left over of his 2 front teeth. Brand new front teeth, right? So we were talking in the office about, she now knows she's going to have, for him, lifelong medical bills. His 2 front teeth will never, ever be the same. So in that instance, she's like, what do I do? They told me, the dentist told me he's going to need a root canal. He'll probably need caps. He'll probably need all sorts of dental work and have to go to the dentist every 6 months to treat it, to make sure that nothing develops as a result of it. So she's worried. He's 8 years old. So let's say he lives to be 90. That's a long time for a lot of dental treatment and care. But don't ever take it for granted. Not everyone has the ability to have good dental care. And we all know, and you all know, that everything connected in the mouth for dentistry is related to the entire rest of your body and how well or healthy one might be. So just remember that, to whom much is given, much is expected in return. Now, the dental school staff did not ask me to say this, but when you get out there and you're practicing law, remember there are students that are talented, that are smart, but maybe they can't afford to go to medical school. Make sure we're giving back to the community, and as we like to say, pay it forward. So figure out what your paying it forward is going to look like and mean. And I'll be honest, at my age, I get great joy out of being able to help others. I've had a wonderful career, a fantastic life that I would never have dreamed of. And I am now at the stage where it's okay to give back. And you all, again, you have a talent, a resource, an ability, and a set of knowledge where you can do a lot of good in this society. So again, following Dean Wolf's lead, figure out what you're going to do to pay it forward for the gifts that you all have been bestowed. Now, when you say 98 days, for some of us, that's a long time. That's May. And a lot's going to happen between now and 98 days. But what I do want you to do is make sure that you stop by and see the faculty member who helped you. Make sure you keep in touch with your classmates. Make sure you've established some good relationships along the way that will serve you well in your journey. With that, I'm going to close and say, again, congratulations. The white coat ceremony is, in my opinion, just very humbling. And again, welcome back to dentistry. You've already been there. Welcome back. And good luck and congratulations. Got it?
Thank you. Thank you, Tamara. Very much appreciated. Okay. All right, before we go to the white coat ceremony, I wanted once again to congratulate the class on the monumental achievement. I don't know where the 2 years have gone by. I remember January 21. I was trying to figure how we're going to have orientation in virtual environment, but you have not only survived but thrived. I know it's been very difficult to go through the dental school once again, but you've done an incredible job, so congratulations. It's been a privilege to working with you. So now we'll go to the white coat ceremony. Each student will approach and tell us where you're from, tell us your name, where you're from. We will have a professional photographer taking your photograph, and the photograph can be downloaded. The two faculty members who will be cloaking you will be Dr. Eric Spiller and Dr. Joy Abt, both clinical associate professors in Department of Restorative and Preventive Sciences. And you will be taking picture with our Dean Wolf as you approach. So please start.
Good evening, everyone. My name is Azhar Al-Mawzani. I'm from Iraq.
Ibrahim Atum from Syria. That way, we want to face the camera.
Okay.
It makes it much easier to get a picture.
Zainab Al-Azawi from Iraq.
Runaz Barzangi from Iraqi Kurdistan.
Marwa Kaba from Iraq.
Right at those dots.
Golnaz Saki from Iran.
Fluff the hair. You gotta get it all.
Sara Masumi from Iran.
Lisbeth Cáceres Chavez from Peru.
Mariana Peraza from Venezuela.
Tenzin Khalsan from Tibet.
Come on over here.
Patricia Gámez from Cuba.
Laura Alvisua from Cuba. Elena Sanchez from Cuba. Yanni Rizzo from Cuba.
Perfect.
Ramon Reyes from Cuba.
You look marvelous.
Tony Portella from Cuba.
Perfect. Right there.
Bella Beck, I'm from Kyrgyzstan.
Perfectly fluffed. It's exactly as.
Delman Malka from Syria.
Michael Abdel Said from Egypt. Congratulations.
Eric? Take your
Dilpreet Kaur from India. Thank you.
My pleasure. Congratulations.
Thank you.
About to say, make it go.
Jigisha Mitesh Desai from India.
Congratulations.
Perfect.
Hi there. My name is Sarang Sherpa. I'm from Nepal. Congratulations. How are you? Absolutely. Great help for us. Thank you. All those graduates. Thank you. Pleasure. Very much. Yeah. Thank you.
Hi everyone, I'm Ruasha Shrestha from Nepal.
How are you? Congratulations.
Thank you.
Got it? You got it.
Thank you.
Hi, Indu from India.
Congratulations. Congratulations to you.
Well, we've almost got you. There we go. And we're gonna now fluff your hair. I know you don't want it tucked into your jacket there. There you go. Perfect. Come on up over here.
Good.
A little bit more.
What?
There you go. Perfect.
Go ahead. You can say your name.
Prashant Kodari from India.
Looking good.
Juhin Patel from India. Congratulations. Good? Yeah. Congratulations. How are you?
Excellent. Come on. Right up.
Anji Yadav from Nepal.
Fluff the hair a little bit. There you go. I know you. There you go. Too much
Good.
tucked in.
Say your name.
Ashima Takral, India.
Pleasure. Hi. How are you? My pleasure.
Just do a little fluffing.
Malti Tuli from India.
Got it?
Jyoti Dhana from India.
Congratulations.
Peenal Vagani from India.
I know they really like the picture, so.
Good. Got it.
Swati Uchur from India.
You got it. You all right?
Thank you.
Wait. 98 days. Go ahead.
Nader Mikhail from Egypt.
Great. How are you? Nice to see you. Ready? Okay.
Hiba Abdul Qadir from Egypt.
Right there. There you go. Looks like it's it.
Thank you. Round of applause for class. Class. Right, so the last part of the ceremony involves signing professional pledge. I'm asking my good colleague, Associate Dean for Academic Policies, Dr. John Black, to lead the pledge with you. Thank you, John.
Now it's time to recite the pledge, so I'd like the class of 2023 to please stand. I'd also like all of the dentists in the audience to join us as we renew our pledge and commitment. So I'd like you to read along with me. You should have a copy of the pledge in your brochures. So as I enter the dental medicine profession, and read along with me, as I enter the dental medicine profession, I vow to keep this pledge and practice these stipulations. I understand that my primary responsibility is to my patients. To the best of my ability, I will embrace the highest standards of oral health care and treat all individuals under my care with respect and honesty, always placing the needs of my patients and community first above my own. I accept the responsibility to maintain my competence through the continued pursuit of new knowledge and skills in the practice of my profession. I will conduct myself with integrity, treat my colleagues with respect, and wherever possible, work to advance the oral health of society. I shall faithfully observe the principles of ethics and codes of professionalism encountered during my dental training and beyond. All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve. Thank you. You can be seated.
Thank you, John. And before we depart, just a big thank to Margaret Yank who organized this with the staff, this event. So now it's the end of the formal part. Please, you're invited to go upstairs to Pavilion for light snacks to celebrate. Thank you.